David was educated at Edinburgh Napier University and also the University of Birmingham. And David is currently an associate professor and the head of exercise research at the University of Surrey. And he was previously at the Duke University in North Carolina. As an immunologist, his research is focused on understanding the mechanisms by which exercise and energy balance can modulate the immune system and inflammatory responses. A primary goal is to identify novel exercise molecules that can be therapeutically utilized in disease populations with limited exercise capacity. David, the floor is yours.
Alrighty, so I am going to talk to you about something that's probably a little bit different for me. You know, as an immunologist, I love talking about cells of the body and the immune system and how they fight infections or how they fight cancer and how exercise can improve them. But you know, as we're coming towards the end of our CLL current stages of work, we've started to realize that everything that we do has effects on some of the symptoms that people suffer from whilst they're either going through CLL treatment or whilst they're waiting for CLL treatment. And fatigue is one of them. And it's a really complex condition. And so excuse me if I don't fill in maybe as much as you want to talk, you want to know about fatigue, but honestly, I don't think we actually know enough about fatigue to really talk about it fruitfully. So one thing that we do know is that not many people actually understand what fatigue is, and so this is the definition of cancer-related fatigue. And we know that it's a distressing, it's a persistent sense of physical and or emotional and or cognitive exhaustion, which is always related to the cancer. And the fascinating part about it is that it isn't proportional to activities of your daily living, and we know that it significantly interferes with daily functioning. But unlike typical fatigue, cancer-related fatigue tends to be more severe, and because it's more severe, it becomes more distressing. And the unusual part about it is it's really unlikely to ever be relieved by resting too much. And if anything, we now realize that probably resting too much to try and get over the cancer-related fatigue is probably not good for you at all. But critically, cancer fatigue is associated with a worse quality of life, and it's really its associations now with a lower likelihood of returning to your work and to your normal daily activities. And I'm sure for everybody in the audience who suffers from fatigue, you kind of know this already. But it's important to start to understand the definitions of it so that you can recognize it, so that you can then start to intervene on fatigue, whether it be by getting help or intervening yourself. So fatigue, as you know, is the most common symptom experienced by pretty much all cancers. And you can see here, this is courtesy of the CLL Support Association and John, Hillary, and Debbie. It's a questionnaire that you've probably all filled in with over 1,000 participants. And on the left-hand side here, you can see the prevalence of fatigue is much higher than all of these other symptoms. Not to say that those symptoms aren't important, but fatigue is the #1 symptom. And when we look at this statistically, we start to see relationships between people feeling fatigue and in some cases bleeding, or in some cases swollen glands and so on. But what was really interesting is that within our group of people with CLL, we don't see a great deal of difference between the feeling of fatigue and the stage that they're at. So people who are active monitoring, about 60%, people who are in treatment are a little bit higher, and people who are in remission just a little bit lower. But generally, it kind of all sits around 60%. But then on that bottom right figure, you start to see the incidence and the amount of fatigue that people feel. And you can clearly see that people with CLL feel fatigue on a day-to-day basis, and it persists over time. And this is obviously problematic because it goes back to the definition and that it's prevalent and it persists. And so then you kind of you know that you're going to start getting into this spiral of events where it's going to be difficult to get out of. So my lab has always been interested in the mechanisms of things, and we're obviously really interested in the mechanisms of how exercise influences CLL, and can we target the exercise to hopefully make stories like Charles's become ubiquitous across everybody. So to understand how to direct programs towards fatigue, we have to start to understand what causes cancer related to fatigue. And unsurprisingly, there's a lot of information about what we think causes cancer-related fatigue in lymphomas and CLL, and this is the diagram that we kind of go by. And if I can just kind of talk you through it, so you see at the top here we have the cancer and the individual, we have cancer-related fatigue in the middle, and then on the bottom we have all of these factors. And what to note is the strength of the arrow. So the thicker the arrow, the more evidence there is that this is causing cancer-related fatigue. And so you can see here the cancer treatment is a bold dark arrow, and on the right hand side we can see these psychological factors. And so for some time we've known that several factors drive fatigue, but the majority of research out there is really found in cancer treatment, such as chemotherapy and targeted therapies and surgery. They seem to be the #1 driving factor for pretty much all cancer-related fatigue. Back to my home field, this inflammatory response. We know that all cancers have an inflammatory condition underlying them, and that definitely relates to cancer-related fatigue, because this inflammatory balance affects a number of different organs, from your eyes to your liver to your kidney. It interrupts with your metabolism, the way that you can eat, and the accumulation of it all is that it kind of feeds back into feeling overwhelmed and fatigued. And then, of course, you have other clinical conditions. Many people with CLL have other comorbidities like diabetes or cardiovascular disease, and they suffer from infections. And you start to see this spiral developing, right, where all of these things kind of contribute together with no real one factor more than the other. And then, of course, we have these tumor-related factors, and in the case of CLL, anemia is very common because it's a bone marrow-derived cancer. We know that there's physical symptoms, including pain and difficulty in breathing. And then, because of other conditions and your CLL, the medication side effects can start to influence how you're feeling as well. So it becomes problematic, and it becomes problematic very quickly. And the quickness of it then results in a longitudinal process, and many people start to have fatigue symptoms that last several years. And I always question whether some people who have had fatigue for so long, do they start to just get used to it, and they start to think that that's part of their daily life, and that may well be the case. But fortunately, we do have guidelines, and there's guidelines out there by a number of different groups. And so you have the lymphoma groups, which I'll show you in a second, and then you have ESMO, which is the European Society of Medical Oncology, so not a heme malignancy. And you can see here that the assessments that are in place are all there to try and work out how to treat your fatigue. And they give recommendations at the bottom here. And so you can see that we have education, and we have physical activity, psychosocial interventions, and then it's all about reassessing. And of course, when you do have fatigue, it becomes distressing, and you don't know where to look for support, and you don't really know what the recommendations are. But there's plenty of places out there that do have support for fatigue. Sorry. And so a number of charities, a number of federal institutes, all have helplines and advice about what cancer-related fatigue is, and some of the potential opportunities that you have to be able to influence your cancer-related fatigue. But in the case of lymphomas and CLL, these are some of the recommendations. And right at the very top, you start to see my favorite subject ever, which is exercise training. And the main physical interventions that were recommended, this was written back in 2020, and we're waiting for the new guidelines to come out soon, are looking at functional resistance work, so some weight training and strength training, some aerobic or endurance exercises like walking and cycling and swimming. And then there's this other part to it as well, which is nutritional consultation and counseling. And really at the end of it all, we start to think about patients with CLL as athletes. And what we want to do is target the weakness to be able to improve some of the outcomes. Now, that's not to say that exercise is the be all and end all, but it's a very, compared to some of the other recommendations like your psychoeducation, your cognitive behavioral therapy, exercise becomes a much easier um, intervention to be able to include as part of your daily living. And of course, at the bottom here, we also have the pharmacologic. So if inflammation is driving some of your fatigue, then there are medications out there that can potentially reduce that inflammation and help. Now that's all great, right? We have all of these support agencies and we have the the guidelines, but it turns out, that we're not really getting the message across as to what to do. And this figure here is some of the problems that are associated with fatigue, and so you can see sleep, rest well, but fatigue doesn't go away in about 60% of people, but only about 10% have discussed this with their doctor. And so then getting referred to these services is actually quite difficult because who do you actually speak to? Do you speak to the doctor? Do you speak to the nurse? And so our healthcare professionals are overwhelmed. And so it becomes difficult for them to be able to, to refer you to the right area. And at the same time, our personal understanding of what fatigue is and our ability to think that we can actually get rid of it isn't really there either. And so then our willingness to speak to our clinicians about it is probably reduced also. So these are some of the exercise recommendations for cancer prevention, treatment, and survivorship. And you can see that the majority of work that is being done is actually for people during and following a cancer treatment. So it's really majority of research has been done in solid cancers and has been done either during chemotherapy or after chemotherapy. And that kind of gives us this cookie cutter approach where perhaps we should be treating everyone the same or giving everybody the same exercise. And hopefully I can convince you by the end of this that that's maybe not necessarily the case, and we have to be much more individual with what we do. But the good news is that we see all of these quality of life events are improved by physical activity and exercise, and all of the big groups who give recommendations to the government have came back with the same sort of things where people should be doing about 150 to 300 minutes of moderate intensity exercise or 75 minutes to 150 minutes of vigorous intensity exercise. And we say those words like everybody knows what they mean. And one of the problems is that I suspect that many of you out there probably don't really know what moderate intensity exercise is and how do you do that. And so one of our goals is that once we have completed our trials is to try and communicate back across what exercise should look like to be able to achieve these quality of life changes. So I showed you the figures from about 1,000 of you that showed that fatigue was the highest symptom that you all felt. Well, Ellie conducted a questionnaire as well, and about 120 odd of you responded. So thank you very much for that. And in that questionnaire, we were much more interested in about how your symptoms relate to what your physical condition and your physical activity is. Because if we can start to understand how physical activity levels associate with your symptoms, then potentially we can start to design a program that is specific to what your symptoms are rather than a program that's designed to say make you stronger when you might not actually need to be stronger, but you need to reduce your fatigue or you need to improve your symptom burden or reduce your worries and fears and your anxiety. But what you can clearly see is, or hopefully clearly see is that in this blue bar here, these are the people who are most active, that they have a much lower fatigue score than people who are insufficiently active, so relatively sedentary, and even people who are moderately active, they are very similar to our insufficient. So more physical activity is associated with a lower fatigue score. And when we did some further statistical analysis, we see that fatigue was associated with low cognitive role and physical functioning and being physically deconditioned. So low physical activity and low physical fitness are associated with fatigue. We've kind of associated them across the board for cancer for quite a while. And we always kind of go back to this: the treatment is causing it, and this is problematic, but we need to deal with it because the treatment is more important than worrying about the fatigue. But then the question becomes then, well, why do people with CLL who have never had treatment have such bad fatigue? And why do people who have normal blood numbers either during or after targeted therapies for CLL have such bad fatigue? And if we target the fatigue with exercise and diet, can we reduce fatigue? Because this is really just a cross section you see here. All we're talking about is people who are maybe fitter or more active. But for those people in the green and the red bar, if I make you more active, does it actually influence your fatigue? So to kind of get to that, we have to come up with a working hypothesis. And this is what our working hypothesis looks like. And I showed you this a year or so ago, and we're continually updating it. But basically what we think is that there is a metabolic effect and there's a drug-related effect. And we know that the CLL cells, we know what energy that they need to survive and to progress, and they're fat-based energy. And we know that by taking that energy, it's preventing your heart and your muscles from functioning properly. And when that happens, you have reduced energetics within them, and it's harder to be physically active, and you'll experience fatigue much quicker. But at the same time, the treatments that some of you are taking, including ibrutinib and venetoclax, they have off-site targets. They do great at killing those B cells, but they have off-site targets in the heart and the muscle as well. And so then that contributes to it, contributes to your fatigue too. And what we know is that probably the majority of CLL mediated fatigue is driven by reductions in the ability to generate energy within tissues and also the ability of your red blood cells to function properly, which is a consequence of having so many CLL cells. And at the end of it, we see this increased fatigue, this low physiologic reserve, and this high physical inactivity, which goes to this increased prevalence of frailty and this worsening quality of life. So what evidence do we have? What evidence do we have that oxygen delivery and oxygen utilizations are impaired in CLL? What evidence do we have that fuel utilization is impaired? And what evidence do we have that these can be improved or modified through lifestyle interventions, including exercise and diet? You'll all be familiar with your red blood cell counts, your hemoglobin counts. Anemia is a common condition within CLL, but I want to introduce you to another one which happens when you get your complete blood counts when you go into clinic, and that's called your red blood cell distribution width. And this is a quantitative measure of the variability in the size of your circulating red blood cells. And what we know is it actually has prognostic factors in there as well for both infectious diseases and cardiovascular disease. And you can see here that people who have a low red cell distribution width have a longer period before they receive treatment, and people who have a higher red cell distribution width have a shorter period. And this was all in treatment naive, measuring them up to the point where they needed treatment. And in the bottom one, we even see survival as well. And so this RDW is a good indicator of prognosis within CLL. And it's a remarkably strong predictor of longevity. And so then you have to ask the question, well, what is the red blood cells actually doing? And we know that red blood cells take oxygen to the tissues and remove it. But when you have these low red cell distributions, primarily in bone marrow disorders, we see problems with it. And when you have high red cell distribution, you have anemia, and we get the problems with that as well. So it's kind of like a Goldilocks paradox, isn't it? We want your red cell distribution to be in this nice normal range at the perfect temperature with the perfect seat. So what happened in our trial? It's not particularly clear to see, but on the left-hand side here is our no exercise group, and we can see that there was a slight change with no exercise, or reduction in this red cell distribution width. These dotted lines are the upper levels and the lower levels of what men and women's numbers should be at. And so you can see some people were way above and very few people were way below. But interestingly, with the exercise training, we didn't get any change. We actually just kept it the same. And this was similar for results of hemoglobin, red blood cell numbers, and platelets, and so on. So it suggests that we're maintaining red blood cell health, but not necessarily improving it, which kind of breaks down the question of, well, if we're not improving it, how can we target fatigue? So in that case, then it has to be more about the fuels. And here are your healthy B cells, and here are your CLL cells. And those CLL cells, all this green, are fats. And the CLL cells love taking those fats up and storing them. And so it kind of bypasses some of the energetics that you see from your red blood cells, and they create their own energy by breaking down the fats. Our exercise training lowered the ability of the CLL cells to take up fuels. And so that meant that more fuel could go to the heart and the muscle. And every time you exercise, your heart and muscle express the receptors that allow you to take up those fuels. So the availability of fuels that cells like was reduced, and at the same time their intrinsic functioning was reduced as well. And so because of this data that we managed to generate from the trial, we now believe that exercising treatment-naive CLL will result in a change to their CLL cells, provide more energy for muscle and heart. And then for the people who are on treatment and don't have any CLL cells, the exercise increases the function of the muscle and the heart to overcome some of the negative effects that the actual treatments have had on them. So does our program improve fatigue? That is the big question, right? Well, I'm glad to say that we did improve fatigue, and you can see here it's about 7.5 to 8% improvement in fatigue. So as the percentage numbers go up, this suggests that your fatigue is reducing, which was great. And this is, in this case, it's about 8%, which in our opinion is clinically meaningful. And what you can see, which was really interesting, is that even in a 12-week window, our control group had a reduced had an increased amount of fatigue, sorry. When we broke it down to our treatment status, our active monitoring in blue here and our treated patients, both of the exercise groups improved their fatigue or reduced their fatigue, while both of the groups who didn't do any exercise endured more fatigue. And then we broke it down a little bit further into some of the types of fatigue, because as I mentioned, we know that the ibrutinib, which is a BTK inhibitor, it targets the heart. And then you have venetoclax and obi, which target the muscle. And then you have chemotherapy. And we were pleased to see that in each of the different treatment groups, we were still seeing improvements and reductions in fatigue. And so that gave us a really kind of nice idea that our exercise program, which we were making specifically for people, was targeting some of these symptoms. So fatigue is complex, there's no doubt about it, but it is so widespread in CLL, and it's so widespread in all cancers, but we just don't understand enough of it to be able to make programs specific. And my lab is really trying to figure out how to make things specific easily, so that when you're in the community, you don't have to come all the way down here in Surrey to get some tests done. It will show you what it is. So I'm hoping in the future we're able to give you a program in your home that will specifically target fatigue and some of your other symptoms, which should then improve your quality of life and improve your physical fitness and improve your well-being. But what can you do in the meantime? Well, if you are suffering fatigue and you are suffering from some of these symptoms, ask for help. When you see your clinician next time, say, hey, look, this fatigue is just getting out of hand. Can you refer me to occupational therapy or physical therapy? Because they have pathways. These pathways exist in a number of different hospitals around the country. They're busy, and so you may have to wait, but they are there. Or you can take matters into your own hand, and you can try to figure out where your fatigue is coming from. And you can go online and you can start to see some questionnaires about fatigue. You fill them in, and the online questionnaires can tell you which part of it is that you're feeling the most. And then you can start to think about doing physical activity. You might start low, and like Charles said earlier, you start to work it up until you can maintain and you keep improving. And the key is that the ingredients of it should always be a little bit different, and they may change on a day-to-day basis. And so your physical activity might change, Your nutrition is important, your sleep is important, your medication review is important. You don't want to go too hard. Don't just jump on the bike and do around the Scottish Isles, because that's going to be sore, especially on your butt. But you can work up to it and make sure you get the correct amount of rest, or an appropriate amount of rest, beforehand. So yes, I would say that exercise for CLL appears to reduce fatigue. And if it does reduce fatigue, what does this mean for frailty and quality of life? Surely that means that we're improving them as well. And to answer those questions, I'm going to hand you back to John. He'll pass you over to Ellie, and then you'll be able to hear all about frailty as well. With that, thank you.